meeting for it. So without further ado, I'm actually going to pass it over to Tara Gadan, our director of HHS, and Penny Lafferty, our assistant director of HHS, for them to go through the presentation. Hopefully everything works well with PowerPoint, because that's always the fear whenever you're doing something like this. But we definitely encourage you to ask questions, give comments. That's really the purpose of this, is to get feedback from you. So I'll pass it on over to Tara.
Thank you so much, Jim. Good morning, everyone. It's so wonderful to be able to see. If I can't see the wonderful, beautiful, handsome faces, at least I get to see your names on the screen, which is great because we really, really missed all of you. We're just excited. So I'm Tara Gadan. I'm the director of Montgomery County's Department of Health and Human Services. And I am joined by, of course, my colleague, Jim. Wonderful. Thank you for that wonderful introduction, Jim, and an explanation of a little bit about today, and I'll explain a little bit more. And Penny Lafferty, our assistant director for the Department of Health and Human Services. And I always say that Penny is the real expert. And so hopefully all of the questions will be given to Penny, but I will try to help out as much as possible. But yeah, so we are here. We are here because we have the Human Services Block Grant, which we apply for every year. So this is the 2021 version. And today really is about hearing from you all. So I will be very, very brief too. And it's really about getting the feedback, right, of how we should move forward, looking at what we should use the funds for. And I just want to say before we start too, that this is such an unprecedented time, of course. And, you know, I find me personally comfort in being able to do things like this as a routine, because we do this every year, and to be able to get feedback and to connect, and to also talk about how we could invest our funds and resources, our time, our energy, to best meet community needs, best be the most responsive. And this is the way we get that information. So thank you for that. So I'm going to do our first attempt at sharing my screen. And so let me see if I'm going to do this. I'm going to share my screen. Oh, so it looks like the host will need to enable me to share my screen. That's the message I got. So I don't know if that's Holly or Jim. Okay, I'm the host now. Thank you.
You're welcome.
All right. So I'm going to share. All right. So hopefully you all can see that. All right. Just can everyone see the screen? I can't see you anymore, but if I can just hear a yes,
yes,
or I can't. Okay, great. All right. So great. So the Human Services Block Grants, these are funds that are available and allocated by the state of Pennsylvania to county governments, which Montgomery County is one, to provide locally identified county-based human services to meet the service needs of county residents. So for the past 2 years, Montgomery County received around $41 million. And I'm going to go through the categories and the focus population and all that. But I just want to put out before we start that, as many of you know, at the end of May, Governor Wolf signed what they are calling a short-term budget that really commits to only 5 months of funding, and most of that is at the 2019, so really flat level funding, including just general level funding for human services. So even though we are saying that last year and the year before we had about 41 million in HSBG money, none of this is guaranteed. And also what it means is that if it's flat and it's only 5 months, this really is an opportunity for all the advocates, service providers, for clients, for those who care about these services, to continue to advocate locally, state, federally, for money and resources to support these critical services to people who really, really desperately need it. So I just want to know that we have a 5 month, and I think the 5 months, it started June 1, I believe. So 5 months after that is then we had to, you know, kind of figure out what the rest of the year is going to look at. But I wanted to put that out there. So we are still working under funding uncertainty, but we are applying, and we are hoping that we get the money to really, again, support these services. So the HSBG There's there's eligible categories, and those categories, so this is meaning how we can spend the money, right? The categories are under mental health services, intellectual disabilities, homeless assistance programs, drug and alcohol programs, and what they call the Human Services Development Fund or Human Services and Supports. And these are generic services, but they're generic services and specialized services, service coordination, money to fill in some gaps, services to the unserved or underserved and unique needs. So that is an opportunity to be a little bit more creative within, again, these categories. And then the focus populations, low income adults, people experiencing homelessness, aging and aged persons, persons with drug and or alcohol addictions, persons with mental health problems, persons with mental retardation, and dependent and delinquent children. Okay. So again, these are the categories and these are the populations. And what I can do is I can go through this, and we have some questions that we would like people to focus on and to give us feedback on. And then I can, we can have questions during that period of time. So I just want to set kind of the stage. All right. Now, before we go into the questions, I always love to say this. So what will the new year bring us? 365 opportunities. I used this slide last year for those who remember, and it's still a time of opportunity, right? I heard in a training a few months ago when we started first going into the pandemic and the kind of the quarantine, is that the Japanese symbol for crisis is two symbols. One is danger and the other is for opportunity. And even though the HSBG is, and we're doing this kind of routinely around, what we invest in, we have to think about what this kind of new world is, and kind of the challenges that will come up because of the pandemic, but also because of just what people are going through, right? Outside of that. So both, but even in that, these are opportunities to really invest, to really make a difference, to really focus and really make an impact on our community. So I always like to coming from a place of hope and possibilities. All right, so although the public comments, forums, and hearings, what we're doing now, town halls, are required by the state as part of the application and planning process for HSBG, we absolutely would do this even if it wasn't required, because we really believe in hearing from all of you, hearing from the community of how we need to, again, invest our funds, our resources, our time and energy and advocacy activities. So to best respond to needs our communities, we must bring together just expertise, right, of our staff. Our staff also puts in input, feedback. Providers, all of you, thank you so much for joining us and vocalizing what you see are some needs. Family members of clients and community members. And that means, of course, giving an inclusive time and space for all of your voices. So this is a piece of that. Our ideas that we hear from all of you, the feedback, we take back to our internal planning and decision-making process. And then we also share, this is what Jim has said, we record this, we have notes, we share all of this with the state. And what's also important is that things that may not be able to be addressed with the HSBG gives us input, though, of how other ways we can partner to meet some of the needs, partner with you all, partners with members of the community, with our other government agencies, how we can invest in other ways, right, to kind of help. So maybe everything can't be addressed with HSBG, but if there's still the need out there, it helps us to figure that out and to work on problem solving creatively to still meet those needs. All right. All right, so before we go into the questions, I would like to open up, just if anyone had any questions around HSBG or anything I've talked about so far, because I really do want to focus the rest of this time on hearing from all of you, but I do want to pause for a minute for if you have any questions around what I just said or just in general about HSBG. And I guess just a reminder to, I think we're all on mute, so if you do, if you are on mute and you do want to say something, just remember to take yourself off of mute, and then when you're done to put yourself back on. So any questions before we go on? Okay. All right, great. So we have these set of questions, and we're not going to go question by question. But I'll read them out. And so however you feel like answering, because this is conversation, discussion. We want your feedback, input. So whatever's on your mind. So the first one, what should the priorities be for the county, right? What are the community needs? So this is especially helpful for what are you seeing with people that you're helping, that are coming to you, that you are seeing as a emerging trend, or just the needs that have been in the past or still the needs that we see now. Okay, what current effective programming should be expanded and or duplicated? So what kind of things have been working really, really well that need to be expanded, or we need to make more of, do more of, possibly do more of in other places? Are there service waiting lists that should be addressed? So that always comes to, that speaks to, again, the need and demand is great, but we're just not keeping up with that, right? So are those areas there? And then what are some service gaps? So things that are not happening that you see that we could be doing, have a role in, or maybe not us, but just in general, there should be some services that are not existent right now. So those are things that we would like you to talk about. Again, no special order, and anything that any feedback input would be incredibly helpful. So I want to keep this up on the screen so you all have that. So I won't be able to see, but I don't know if Penny, before we start, if you had anything, or Jim, it's hard for me not to be able to see people, but, and again, if you need to say something, please make sure you unmute and then you mute back when you're done. All right.
Hi, Terry. The only thing I'll say too is if anybody wants to put something into the messages, I'll keep my eye on that. And then as comments come in there, I'll call out to you, Terry, that there's a comment, a message.
Perfect. Thank you, Jim.
So we do have something, Tara, Jim, and Penny in the chat from Joe Resevich from the Foundation for Pottstown Education. And he is saying that one of the funding priorities should be addressing the inequity of school funding.
Great. Thank you.
Hi, Tara. This is Diane Conway from Max Association. We're an association of human service providers in Bucks, Chester, Delaware, and Montgomery counties. And our membership serves a lot of people with intellectual disabilities and mental health involvement. And what I'm hearing from the providers is exactly what you were saying about a crisis, that it has provided opportunities. And we kind of had it forced on us, but I've been really impressed with the innovation of the providers in using telehealth. And I think we really have to focus on that. I think it's done some wonderful things. It's not for everybody, absolutely, but I don't think we can take a step back in telehealth. I think it has been reaching people who it wouldn't have reached. I think there's high customer satisfaction, and I just think we need to go down that path.
Awesome. Thank you, Diane. Thank you so much. Awesome. Telehealth. Excellent. Thank you.
Hi, this is Stacey Dougherty from Laurel House. Can everyone hear me?
Yes. Yeah.
Great. One of the thoughts that I have is, as we sort of deal with the economic fallout from the pandemic and everything as we move forward, is that we're going to have a lot of folks who are going to be either, unable to maintain their housing. So as the eviction moratorium gets lifted, maybe expansion of the EPIC program, getting that into more courts, maybe having it start a little bit earlier than at the date of the eviction hearing, but definitely supporting families who may be financially unable to maintain their housing throughout the county.
Excellent. Thank you so much, Stacey. Thank you. Thank you. Thank you.
Can I go again? This is Diane Conway.
Sure.
Yeah, during the pandemic, we saw, because of the number of people in prisons that had COVID, we were seeing people released at an unprecedented rate to try to stem that. And there was no supports for those individuals as they left and transitioned. So I would urge the county to take a look at that situation.
Great. Thank you, Diane. Thank you.
Tara, I want to throw out a comment that had come in onto the chat. I think that the epidemic has shown the gap between people who have access to technology and those who don't, and the impact of that. It's a complex problem. Many people don't have access to the internet, and many who live in congregate settings don't have privacy. But we've seen how isolating it is not to have access to technology.
Excellent. Excellent. Thank you.
Hi, Tara and everyone. This is Emma Hertz from the Health Spark Foundation. As some of you know or have been involved with, our foundation has been bringing together some community partners recently around an effort called Build Back Better. And one of the main themes that has been coming out of that effort so far, as nonprofits have been talking about their experience over the last few months, two things. First is that organizations led by people of color have been adversely impacted and disproportionately impacted by the pandemic because of decades of underinvestment in their organizations. And so they tend to have less capital, have been less able to respond to the situation at hand. And so I think a priority for the county should be considering how it can use these funds to support organizations led by people of color, nonprofits serving communities led by people that look like them. And a second issue somewhat related to that is that a lot of nonprofits have been sharing the people that are working for them, so the social workers, frontline staff, have not been paid a livable wage in the county. And that has not only contributed to their financial experience of the pandemic, the experience of maybe having hours cut, but really just not being able to respond financially in their own personal lives, but then also having the added trauma of the experience of working with their clients through this situation. And so there's been an incredible level of stress and burnout for people who are working in nonprofits. And so thinking about how to use funding effectively from this source to first and foremost ensure that everyone who's paid out of the Block Grant is paid a livable wage and provided health insurance. And I understand there are different regulations about that, but looking at contracts to make sure that at least these funds are doing what they can to support that. And then second, thinking creatively about how to use funds for trauma-informed care and expanding on many of the great programs that are already underway at the county to lead forward on that effort.
Emma, thank you so much for that. Excellent. Thank you so much. Thank you so much.
This is Joe Rasevich from the Foundation for Pottstown Education. I just want to echo what Sue said and what was read on the chat about the inaccess to the internet. 1 out of every 4 children in Pottstown do not have a device to connect to the internet or the internet, which created a problem when we went to online learning because we could only allow the grades that had 100% access to do that. So we were then stuck handing out, distributing the work at the food lines for the kids. Our foundation is doing a campaign to raise funds to purchase 1,000 Chromebooks, but we're not there yet. And so it's again going back to my first statement about the inequality of the funding in the school districts.
Thank you, Joe. Thank you for that.
Hi, Tara. This is Holly. I just want to chime in with some of the things that TCN is hearing as an organization from our member partners. One of the concerns, and I think it's sort of always been an outlying concern, but it's more acute now during this time, is funding streams that are available for operations for nonprofit organizations. I think most of the funding that is available, even during COVID, that's available is more geared toward programs and projects and not necessarily toward staffing for the organization and building capacity and infrastructure for the organization. So I think, you know, if there was a way to encourage funds to be set aside for operations for, you know, the nonprofits that are serving the community, especially, you know, during this time, that would be very helpful.
Excellent. Excellent. Thank you, Holly. Thank you for that. Yep. Yep.
As a nonprofit, it's Joe Rosevich again. I want to echo that Holly said. A lot of nonprofits or organizations for nonprofits are now looking at the way that grants are given. And if it weren't for the administrators and the directors of the program, these programs would not happen. So if you don't put the money in towards paying them, you're not going to have these programs at all. So, you know, the way that your reports are given now should include operations as part of the program, because again, the programs wouldn't exist if it weren't for the operators.
Yep. Yep. Thank you, Joe.
There's a comment that had just gone up onto chat. Not sure exactly what Montgomery County is doing to bridge human services with law enforcement. 80% of what police do is human services and 20% is law enforcement. So funds can link human services with law enforcement.
So for the person who had wrote that comment, would you mind expounding a little bit on the law enforcement? So you the working with just a little bit more. I just need a little bit more clarity when you got the law enforcement piece. And you can write it in there. Just you don't have to say it out loud, but just a little more clarity on were there specific things you were looking for, a specific outcome. Yeah.
Just as the addition to that, any interactions are with individuals with mental health and homelessness. So having human service organizations working hand in hand with law enforcement.
Ah, okay, got it. Okay. Yep.
Hi, good morning, Tara. This is Owen Camuso from Resources for Human Development. I just wanted to answer your question about our services around the waiting list and some comments that have already been made about maybe seeing an uptick in homelessness. And currently we have a waiting list to get into shelter services. So I know somebody mentioned some diversion stuff, eviction prevention, but I do think that we're going to see an uptick in that. And then no one's really commented on the substance abuse side. I think that during this pandemic, we might have seen an increase in substance abuse and might need some additional needs for services.
Excellent. Thank you, Owen. Thank you for that. Excellent. Yep. Okay. Mhm.
Good morning, Tara. Can you hear me?
Yep. Good morning.
Hi, I'm Lauren Flynn from Mental Health Partnerships.
Yeah.
And we have a few different programs here in Montgomery County, but I do want to agree with the telehealth. We peer support, and telehealth is not the best model for providing peer services, but I think it still should remain an option for those individuals that it's working for.
Excellent. Excellent. Thank you so much, Lauren. Thank you.
And I have another question or another comment.
Sure.
I also like to piggyback on the homelessness situation, especially a privately funded shelter, but it's only November, March. And I think as things start to reopen and the people start to get evicted, we're going to see an increase in the homeless situation. That's already a problem in Pottstown, and we need to make sure we have services. And also a lot of that goes in hand with mental health and substance use.
Right. Great. Excellent. Thank you, Lauren. Thank you so much.
You're welcome.
Yep. The service in Pottstown. Yep. Mhm. 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 Mm.
So Tara, this is Holly again. One thing that we're seeing, well, two things that we consistently see in our community that has become probably more acute due to COVID are the need for greater transportation access, as well as the need for, as Emma mentioned earlier, the living wage employment is, obviously extremely important, especially given the unemployment rate in Pennsylvania right now. So those are two things I think for the western side of the county that we're here pre-COVID, but remain really acute and important issues and of concern for the community.
Mm-hmm. Thank you, Holly. Yep.
So Tara, someone asked a question in the chat, what would be the potential funding period for this? So what does the funding cycle look like for the block grant?
Sure. And Penny, can I give that one to you?
Sure. It's July 1st through June 30th.
Thank you, Penny. Yep. And we've heard anything that was changed. Everything seems to be on the same timeline as before. So we don't foresee that changing. So which is a good thing. Yeah.
So Tara, for those who don't know the process, so basically the state is providing the county with funds that the county will then use to address issues that we're talking about essentially today, either through county programs or through funding to the organizations that are tackling these issues.
Exactly.
Okay.
Yep. So a state funded, state funding based on those, there's eligible categories that we went through and then eligible populations. For the past 2 years, we've gotten about 41 million in HSBG funds. Mm-hmm.
Sarah, there's another comment that's hit. There's always a need. There's always the need for teen suicide prevention funds for schools to explore this with human service providers in new effective ways.
Yes. Yep. Thank you. Mm-hmm. Mm-hmm. Mm-hmm.
Another thing, this is Holly again, sorry, that we've been hearing a lot about is I think that the clarity around what will happen with the schools reopening is going to have a trickle down effect on the nonprofit organizations due to childcare and potentially increased need of services if schools change the way that they are reopening. So if they're, having students either, as Joe mentioned earlier, do online learning or, some sort of hybrid method, which seems to be, I think, the direction that most schools are leaning into right now. It could be an opportunity for nonprofit organizations to get creative to provide support to the community, especially those elementary kids that maybe cannot stay home alone, but their parents need to get back to work. So I think there's going to be a whole wave of need around that once the school districts decide how they're going to reopen and what that looks like.
Mm-hmm, mm-hmm. Thank you for that, Holly. Thank you. Yeah. Mm-hmm. 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 Just for my curiosity, so our Office of Senior Services is doing their strategic planning, and they're doing very similar. They're having town halls and public forums, and to get this feedback specifically around our senior population. Is there anything that anyone on this call see as an emerging need or trend around our seniors? Like I said, they're also collecting that, but I know we haven't talked about that yet this morning. So I was just wondering if anyone had saw any kind of emerging trends or anything that is pressing or extraordinary, out of the ordinary with our seniors.
I kind of waited to see if anybody was on from our local agency, but I know they recruited a group of volunteers to go grocery shopping for the seniors.
Mm-hmm.
So I did that, and once a week would go to the person's house, should have a list ready with the money, go pick up the food and bring it back to them.
Mm-hmm.
So I know they were looking for volunteers at one point for that.
Mm-hmm, mm-hmm. Excellent. Thank you, Joe. Thank you. Thank you. Yep. 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 Mm-hmm, mm-hmm. Okay.
Tara, one of the comments that are out there is that a strong partnership between HHS and the IU and its members during is very important.
Mm-hmm. Yep. 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 I totally agree. Mm-hmm. 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 Mm-hmm.
So another thing about seniors is, I work within the mental health community, and the thing that I've definitely seen is, and we all know that living with mental health challenges and taking medication and all those sorts of things takes a toll on people, and I don't think that we're still routinely sort of having in our head the alert of age at a different point than with traditional seniors, if you see what I'm saying. I think that the people are in their 50s and they're experiencing the same kind of things that you would expect in an older population, and you sometimes I think the signals are being missed with that, and I really worry about people just being vulnerable in terms of that.
Yes, 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 yes. Thank you. Sue, right? Sue? Yeah.
Right.
Thank you, Sue. Thank you for that. Yeah. So mm-hmm, 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 mm-hmm. Okay.
It's Stacey Dougherty from Laurel House again. I know we talked a little bit about technology, and how there's an inequality there with access, but also maybe allowing nonprofits, sort of freeing up some funds to create or allow nonprofits to build their infrastructure in terms of using technology more, enhancing their technology, whether it's internet access or ability to work mobily, that sort of thing. But if we want to increase access to the clients, we should also look at how the infrastructure exists at nonprofits already and whether or not we can even meet that need.
Mm-hmm. Excellent point, Stacey. Excellent. Thank you. Thank you for that. I've been trying to hold back my comments because I have a opinion about everything. But the two things that I do want to say is that last year the telehealth came up real strong, and I think we made roads in the year. But what really pushed it was the COVID-19, right? Of then people being forced to do things differently. And that actually there's piece. I mean, we know there's some challenges, but there's ways that could work. And I think the same thing with the building the infrastructure to technology. I think some of us were ready and some of us weren't. But it's like we kind of were forced to do it. And now I think didn't do it before because of just kind of tradition. And now that we're forced to do something different, now I think it's an opportunity, right? To say, okay, how do we continue to do this, or how do we make this work? And then, what kind of then investments, funds are needed to, like you said, Stacey, build the infrastructure to actually have the equipment to change the mindset, right, in every part of our world. So thank you for that. I think that's an emerging as a current, and then it'll emerging, and it's an opportunity to do things differently, but we need the support to do that differently. So thank you for that. Yeah. So I want to make sure that we have enough time for everyone who wants to say something to say something. So we'll continue, but I also want to, let me just do this real quick and then I'll go back to the questions. But I don't know if you can see, but I put me and Penny's email addresses here. So you can absolutely email us if you have more thoughts. Just kind of like, oh, I forgot that, or this is a need, or this, I want to share this with you. Please, 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 please don't hesitate to email us. And we will take feedback until when, Penny? When are we taking feedback until?
Sorry, I just came on. I think we can take it for 2 more weeks. So
2 more weeks?
Yeah, till like July 14th.
Excellent, excellent, excellent.
I believe the plan is due on the 19th.
Okay, perfect, perfect, perfect.
Mm-hmm. And if I can just add, there's been a lot of technology requests out there. And as probably almost all of you know, the county did receive CARES Act funding. So we will be, and hopefully the different program offices that you work with have already reached out to you. But as a county, we're also, actually Jim and I looked at an OpenGov kind of survey yesterday that we'll be putting out to the community members, hopefully, if we can get it to work the way we want it to. But I would definitely encourage you to reach out to the program offices that you currently work with for technology. Some of the ongoing internet stuff gets a little tricky because CARES Act is a one-time kind of thing. But especially for the tablets and those types of things, please reach out and let them know what you need. I can't guarantee you we can get it, but that is the purpose, for this CARES Act funding. So again, please make sure that your program offices and or email Tara and I are aware of what your needs are.
That's right. Excellent. Excellent. Thank you, Penny. Thank you so much. Thank you. Thank you. That's
Penny,
good.
Penny, would you be able to talk? Are there any deadlines to that for CARES Act funding? Like they need to respond by a certain date?
No, there really isn't. We're still waiting, I believe, to hear from the state on exactly when the CARES Act funding has to be expended by. Initially, it was by the end of this year. So the county just hired a consultant maybe within the last month to actually help us figure out how we can spend this money, what we need in our contracts, what is eligible, what do we need as far as monitoring to make sure the money's spent the way it's spent. So we're kind of in the early stages still in the county, but we are starting to talk about how do we get that out there. I know each of our program offices have submitted ideas for CARES Act funding, and the county does have those lists. But I don't know, well, I have seen them, I do know. There's not really specifics behind them. So I'm not sure if the program offices have the specifics as to what your individual needs are. But again, I would encourage you to do that. So as of now, I can see us reaching out to the community probably within the next 4 to 6 weeks, but we have to have a process in place. And it's the community, it's the townships. I mean, that money was not meant entirely for county government. It was meant to help community partners. So it's important that we do know what your needs are in those regards.
Mm-hmm. Mm-hmm. Yep. That's good. Yeah. Thanks. So any more ideas or comments? Okay. Okay. All right. Well, I think we're good. I think we got a lot. So thank you so much. So again, please, if anything else comes up, please don't hesitate about this or the CARES funding, anything. Please don't hesitate to email me or Penny. And I just want to say that our next, so we'll be doing this again virtually. First, I want to thank TCN and Holly for hosting this. Thank you so much, Holly, and all of your members. We sincerely appreciate it. We really, really do. You are just wonderful partners, and we can't even think about doing any of this without such great partners like you. So thank you so much, and everyone on the call. Our next one is going to be July 9th, and ICN, that's the Interagency Council of Norristown will be hosting that one, 9 a.m. If you want to join that one, you still have to register, and then you can email us for we can send you a flyer. I think we have that, or Jim has those too, but any of us will give you a flyer if you want to join that. But again, please don't hesitate to email us. We're all working still from home or mobily, so you can't come into the office to sit and chat, but we do check our emails all the time. So if that's it, if we are good, I thank you again. I don't know if Jim, you want to say anything else, or Penny, but I'm good. You're all good. Yeah.
So this is Holly. I just want to thank Tara and Penny and Jim for the call today, and for your openness to hear some suggestions and feedback, and your availability to talk through some things with the nonprofits, especially during this extraordinary time. So thank you as always for your partnership and your support of the community.
Oh, thank you, Holly. Thank you so much. Thank you so much. Thank you so much. Yeah.
So with that, I believe we are good, unless Jim or Penny, do you have any closing thoughts that you'd like to share?
Nope, I'm good.
Thank you, everyone.
All right. Thank you all so much. Tara and Penny's information's on the screen, but if you need that after the fact, please feel free to email me, and we have recorded this meeting as well. So we can certainly provide access to that in addition.
Excellent. All right. All right. Thanks.
Thank you all.
Thank you.
Take care.
Okay.